Hey class, in this video we are going to study the male infertility. Male infertility, from the definition, it refers to the inability to conceive after at least 2 years of unprotected sexual intercourse. 2 years. And the female has a normal reproductive function. So from the definition, if a patient comes to you for male infertility, and the patient tell you they only married for half a year, so in this situation, or if they only have unprotected sexual activities for half a year, in this situation, you cannot diagnose this patient as infertility, no matter male or female. It must be at least 2 years. And from the definition, it seems very obvious that the male infertility means the problem is in the male. That's why we said the inability to conceive, but the female has a normal reproductive function. From the theory, it's reasonable, but in the practice, in practical, it's quite unreasonable. The reason is because the female has a normal reproductive function. How do you know the female have a normal reproductive function? It is actually very difficult to test or to exclude the problem from female. The infertility, the male and female infertility, the infertility from male's parts, it is slightly easier to find a cause, such as the routine sperm analysis. If the routine sperm analysis is everything's normal, then we consider that the problem is from the female. However, if the routine sperm analysis is abnormal, and then we also cannot exclude the problem from the female. So that's something you need to think about. Although from the definition, you can see that it is the male's problem. After 2 years, the female is normal. But the problem is, how do you know the female is normal? And in this situation, we must ask the patient to test the routine sperm analysis. Because from infertility, we need to focus on both. If the routine sperm analysis is normal, then we can focus on the female only. When we study the female infertility, we will see how to analyze the female's reproductive function. But when we study the male infertility, especially when we see from the routine sperm analysis, if abnormal routine sperm analysis, what should we do? Such as the increase of abnormal semens or the defecation. The etiology to analyze the infertility is very closely related to kidney, the heart, liver, and spleen, especially the kidney, because the kidney, the function of the kidney in charge of the reproductive system. Main symptoms will be same as in the definition. After 2 years unprotected sexual activities without conceiving. And then from the physical examination, sometimes we can see the abnormal developments of the male's testicles. In some situations, the patient also will tell you that the abnormal semens or less volume or even no semens coming out after the sexual activity. So these may result in infertility. One of the most common examination is the routine sperm analysis. So you can send the patient to the lab for this test, and you will see the results. Due to the kidney exons deficiency, because of the exons deficiency, exons is the liquid form, less volume of semen. Increased abnormal sperms, this will be in the reports. Disorders in liquefaction, this also will be in the reports. And then plus the kidney deficiency symptoms, such as the weakness in the waist and kidneys. Kidney yang deficiency. Yang deficiency, yang focus on the movements, the active parts of the substance. So yang deficiency, lack of yang, will result in low motility of sperm. So this also can be seen from the reports. Fatigue, cold, yang deficiency will result in coldness, cold limbs, pale. Qi and blood deficiency. In general, qi stagnation is tending. Damp heat, increase of normal sperms, especially dead sperms. So in this situation, because of the heat kills the sperm, so increased dead sperms, damp heat, accompanied by spermatorrhea, scanty urine, and these are all the heat manifestations. Human principles: kidney exons deficiency, yang deficiency, qi and blood deficiency. So basically, you're going to separate them into excess or deficiency. Excess or deficiency. For deficiency, going to tonify. For excess, going to reduce. The main points: room 6, room 4. Spleen 6, kidney 23, bladder 33, bladder 54, 36. Room 6 is in the lower abdomen. This is also the qi hai, the Chinese term. Qi means the qi of the body, hai means the sea, so it's the source of the qi. Room 4 and spleen 6, the meeting points of 3 in meridian. These 3 points, room 4, room 6, spleen 6, can tonify the spleen, can tonify the qi. You also can tonify the liver and kidney. Kidney 23 is the back-2 points of kidney. Bladder 32, those a few points are in the lower, on the back at the lower jaw points. So you also can strengthen the lower jaw. Kidney is in the lower jaw. So don't always think about the physical kidney. Kidney is in the lower jaw. And the bladder 54, so the bladder 54 and bladder 32. Bladder 32 and bladder 54 at the lower back can strengthen the function of the lower jaw. Number 36, to tonify the acquired qi. In exons deficiency, we can add kidney 3, the yuan source points of kidney. Yang deficiency, we can use Moxibustion on room 8. Qi and blood deficiency, focus on the spleen and stomach. accompanied with other symptoms, palpitations, insomnia that are related to the heart. We're going to focus on the heart and pericardium. Qi stagnation, blood stasis, level 3, the 17. Damp heat, spleen 9, room 3. Needling technique. Letter 32, letter 54 points to the needle. The needles point to the external genitals. Moxibustion can be used on those points that have the function of tonifying. You can enhance the tonifying function. For the frequency of the treatment, you can apply the treatment every day, once a day. You can continue for 10 to 15 days, and then you repeat again. Just in general, that's for male infertility. For the primary sperm, the primary to mature sperm, it takes about 80 days. So it's about 3 months. So for this problem, it may take such very long time to see the results. This is because of the mature of the sperm takes such a long time. Apart from the treatments, we also need to advise the patient to have a healthy lifestyle, such as reduce tobacco, reduce alcohol. Also, in some not common situation, we need to advise the patient when to have the sexual activities according to the female's menstruation cycle. In this video, we mainly discuss the male infertility from Chinese medicine perspective, particularly in acupuncture. Sometimes students may confuse. Does it work in this way from the Chinese medicine theory? The reason is simply because the explanation from Chinese medicine is very different from conventional medicine. So here, we're going to share one case with male infertility, a patient 38 male. We are not going to discuss in detail in terms of the treatments for this patient. The reason is because I treat this patient with Chinese herbal medicine. The reason that I didn't use acupuncture for this patient is simply because acupuncture is inconvenient for this situation because the patient needs to have the treatment every day or at least every second day. However, in terms of the distance in Johannesburg, this patient lives about 40 km away from my practice. So it's just not convenient to use acupuncture. So I use herbal medicine. But the theory, how I construct the herbs, how I prescribe the entire formula is exactly same theory as what we have studied here. The etiology will be the same. So we're going to see the report first, and then I'm going to explain the reason why I choose specific treatments or specific function of the herbal medicine. And then in future, when you see similar results or the reports, you may explain in this way to guide your treatments. Okay. So this is the initial reports. This patient got the semen analysis in February this year. So this is the report and before the treatments, and this one is after treatments in September 8th, so just a few weeks ago. These are the original reports. We're going to see these two when we put together. The patient rests for 4 days before have the test and 3 days before the test in September. When you see the reports, you will see the volume of the semen, 1.3. This is low. It must be above 1.5. It will be between 1.5 to 6 millimeter. So 1.3 is less. The pH still in the normal region, and sperm concentration 30.25 million per millimeter. The total sperm counts 39. The normal sperm counts. This is very important. Although this patient has so many sperms, or the sperm count is just above the minimum requirement. However, the normal sperm count is 0.44, less than normal. Okay. And then the motility. The motility, these sperms, some of them can move, some do not move. So we must see the progressive PR must be above 32. The one doesn't move, 51%, more than half of them doesn't move. The total motility, 48%. So when I see these reports and then obviously we need to compare with the symptoms and signs of this patient. But just in terms of the reports, what can we see here is the scanty or less volume of the semen. The semen is something physical in the liquid form that we can see. So this is in. Okay. So from the theory, this is in. Less volume. This is in deficiency. So in deficiency, that's the first conclusion you can see from the reports. Okay. The normal sperm counts, the total sperm counts, also not enough, or in the very limited count. This is also in deficiency because in are something formed, as we can see. And then in terms of the motility, something move, and there's another one in the next page. We will discuss that in terms of yang because there's something move. So this patient, from the reports, got both yin and yang deficiency. That's from something physical we can see, and the movements of the sperm. The sperms do not move when there's yang deficiency because yang is active. So from the reports, we have the general idea that this patient may be both yin and yang deficiency, but which yin and yang? We're going to focus on the kidney yin and yang. The kidney yin and yang also may relate to the liver. So our treatments will be based on tonifying kidney yin and yang. And then you can adjust your treatments according to the patient's symptoms and signs if you need to regulate the liver function or not. The fundamental treatment will be tonifying yin and yang, the kidney yin and yang. But when we tonify kidney yin and yang, these two are very different categories. One is yin deficiency with deficiency heat. Yang is yang deficiency, it's internal cold. So now you're talking about deficiency heat, a heat symptom, and cold syndrome. So which parts you're going to focus on? So here, firstly, you need to compare with the other signs from the other diagnostic techniques, such as the facial complexion, the pulse, the tongue. Okay, so that can help you to identify which part is dominant is it yang deficiency dominant or yin deficiency? Then you can focus on one of them, the dominance, and accompany with the other. For example, if this patient, in your conclusion, the dominant part is yang deficiency, you're going to tonify the yang deficiency, accompanied with yin deficiency, accompanied with tonifying yin techniques or the medicine, either use herbal medicine or acupuncture. So once you must identify one part as dominant. From the other theory, that's the yin and yang theory that we study in the basic theory. Something formed is from formless. That's in the contents of yin and yang. So if you don't understand what we are discussing now, you must go back to the basic theory, the contents of yin and yang. You will see formed is from formless. Yin is formed. Okay. The sperms, the volume, the sperm counts, the individual sperms, these are something formed that we can see. Something formed is from formless, which means the yin is from yang. So from this perspective, you also need to tonify yin and yang to strengthen the function of yin and yang. Okay, because I'm pre-recording this video, the slides won't allow me to go back once I move to the next slides. So I just going to show you the results first before we move to the next slides. You have the notes. You can go through the notes by yourself in the next slides. Okay. After 4 months treatment, this patient started treatment on the 31st of March until 7th of September, just before the test. Okay. The treatment I prescribed is from the Chinese herbal medicine with the herbs tonifying kidney yin and yang, both yin and yang, specifically focusing on kidney yang. We see the results. This is after 4 days, but this is after 3 days. After 3 days, the volume increased to 2 millimeter. Okay. And then when you see the sperm counts, the significant changes, improvement from sperm counts from 39 million to 142 million. That's about 3.6 times. Okay. The normal sperm counts is even more significant because this will determine the function of the sperm. We need the normal sperm counts for this treatment for infertility is 1.38. Is more than 2 times of the normal range. And then for the motility, the PR is quite similar, 38, 37, but the non-NP improves. And also the immotility, the one that move, reduced from 51% to 35%. And the total motility increased from 48% to 64%. So the normal range must above 40. In terms of the velocity, the rapid movements, the medium movements, when you see these two, when you combine these two plus the rapids and medium, okay, a significant improvement. The slow also improves. So just in general, the one doesn't move reduce significantly. 51 to 35.6. The mucus penetration 1.1 increased to 5.6. This patient still, this is similar, so we still continue the treatment for this patient. But when you see the results in 4 months' time, the improvements from the left side to the right side, although we use a herbal medicine, but the theory is exactly the same. So in future, although you don't use herbal medicine for this program, you can use acupuncture, but the frequency is very important. But from the reason we show in this case, you can see from the theory that if you use this theory correctly, you will see good results from the treatments. When you focus on kidney yang, you can use room 6, room 4, the kidney transport points on the back, the kidney yuan source point of the kidney 3, the kidney yin, such as spleen 6, spleen 9, still room 4, room 6. These points you can use. The most difficult parts, especially for local patients, is the frequency. If you apply acupuncture, for instance, once a week, or even once in 2 weeks, twice a week, the results won't be as significant as this reports. For this patient, we use herbal medicine, and this herbal medicine, the patient take every day, twice a day. So for acupuncture, we also need the frequency. But from here, from the results, you can see the theory. If you can apply the theory correctly, then you actually will see very good results. In this video, we mainly discuss the male infertility in terms of the etiology, the treatment principles, the specific treatments on specific syndromes. We also share one case on male infertility, and we use the theory, the acupuncture theory, to guide our treatments, and we can see the effectiveness of the theory. Thank you for your attention.